This clinical skills video is about intramuscular injection. We will talk about the procedure step by step, the 7 rights of injection, as well as the complications, contraindications, and indications of intramuscular injections. To begin with, greet the patient, introduce yourself, verify the patient name, medication order, and file number, and explain the procedure. Always remember to greet the patient because this is marks for you in this exam. Student will obtain consent and will note allergies to cleansing solution and to medication. Ensure privacy and request for a chaperone. Wash your hands. Gather the supplies, which will include a needle, a syringe, cleaning swabs, a sharps box or sharps container, non-sterile gloves because this procedure is not a sterile one. Draw up the medication and note for the expiry date. This is so to ensure that the medication is good for use. You will change the needle before injection into the patient so as to not introduce any contaminations into the patient. Position the patient and cover the area to be injected, draping as needed. Identify the proper landmarks for safe injection. You can use one of 3 sites: the vastus lateralis on your thigh, the gluteus muscle on your buttocks, or the deltoid muscle on your shoulder. Always taking the upper outermost quadrant as your point of injection. Ask the patient to relax the muscle and disinfect the skin in an outward spiral direction at least twice. Insert the needle swiftly at an angle of 90 degrees. Aspirate. If blood appears, withdraw the needle and start again, and if not, you can proceed. Inject the needle slowly and stabilizing it. Withdraw the needle swiftly and discard in the sharps container or sharps box immediately. Failure to do so will mean that you have failed this examination, so always remember to discard the needle in the sharps box. Press sterile cotton wool onto the opening and fix with strapping. This is in order to stop the bleeding. Observe the patient for reaction, cover to maintain privacy, and thank the patient. Clean up the area and wash your hands. Express the need to document the injection and include the time, the site, the name, and the dose of medication. This constitutes the 7 rights of injection. I will go over them again: the documentation, the time, the site, the name, the dose, the right route, and for the right reason. For your reading assignment, your AAs expect you to know the indications, which can be either therapeutic or diagnostic, but grouping them as such is not really important for this examination. Just know them as they are listed in the video. Your contraindications can be absolute or relative. Again, it is not really important to group them as such in this examination. Just know them as they are listed in the video. And complications can be early, intermediate, or late. Again, all I want you to know is that you will have bleeding, pain, nerve injury, as well as needle break as complications for this examination. Thank you so much for watching this YouTube video. Be sure to subscribe and watch